Vice President Suzanne Rohrbaugh and I are standing in one of our simulation rooms. And simulation is one of the incredible features of this whole facility. And it allows us to do so much. And she's going to tell you a little bit about what simulation is and how it will be used for our students.
Thank you, Dr. Shackleford. Simulation is such an integral part of what opportunities our students will have with this new facility. As you can see, this is set up like an actual hospital room. We have our mannequins that are able to be programmed for all kinds of disease states. The opportunity students will have is to be able to perform some of their tasks and learn their skills in a very safe, controlled environment. Many times our students go to clinical sites and are not able to see all the different patient scenarios. And in a simulated environment, we can actually play those out in a very safe environment where students can be successful, but just as important, they can fail in those scenarios. And then that provides them an opportunity to go back and see where they could have done things differently and perhaps treated that patient in a different manner. We're able to program these mannequins to simulate conditions such as cardiac arrest, a stroke victim. We can administer medications, and again, it's a very safe environment. You can video these scenarios. As you can see, we have cameras in each of these rooms. We have control rooms that will be controlled, and those simulations played out with our instructors. Students get the opportunity to interact with one another, and again, it simulates that real-world environment.
Welcome to our EMS classroom here in the Allied Health Center. And this, as you see, has our bay where our ambulance can bring and deliver patients or pick up patients. And this is the classroom, and you see mannequins and all that kind of thing here. Vice President Everett Lassiter is over this area and this program. And why don't you tell us a little bit about this program and what kind of jobs these people get when they get out?
Okay. Hey, we're excited about our new facility here, and our primary programs here are the entry-level EMS, the advanced EMS, and also paramedics. Once you leave here, you'll be trained or eligible to sit for an exam in any state in the United States as a paramedic. And our primary training workforce comes from our own Randolph County, right across the street. So they send us potential students, and we use their instructors, and we train paramedics in EMS. We're excited about this new facility here. We have some of the latest technologies available for our training. As you can see, Dr. Shackleford just mentioned, we have an ambulance that is fully loaded and can actually go on calls. And our students, once they train here, part of their training and their clinicals is they'll ride with other paramedics in Randolph County on calls. Also within this facility, we have an apartment complex, or an apartment room rather, that students can go in and practice. If someone is in the bed and has an illness, or if they've fallen and they're in a restaurant, in the bathroom or in the kitchen, we can walk them through. They can bring them out and bring them all the way through our facility, all the way to our ambulance here. So as Dr. Shackleford just mentioned, one of the greatest facilities around. We train not only our paramedics, but we have, if you're a 911 dispatcher, we have right across the hall here, CEs for that particular training as well.
We're now in the radiography area of our Allied Health Center. Suzanne and Tami.
The traditional x-rays that you think of when you go to your doctor's office for like the chest, or you've entered a different type of body part. And then while the students are with us, they do have the opportunity to explore some of the other imaging modalities, such as ultrasound, nuclear medicine, to see if their interests also lie elsewhere. So radiography is a wonderful profession to get you started into healthcare, and you also have the opportunity to grow and branch out really as much as you'd like to.
Well, again, we're very proud of the program and so many students we put out in the community in the healthcare field. Tami, how are the students and the faculty responding to the facility, and how will this facility serve you better than the old facility that you came from.
It has been a wonderful change for us. Equipment is so much more realistic to what they see in hospitals, much more updated. We can simulate in here so many more procedures because of the space and the fact that the equipment is hung from above instead of mounted to the floor. It gives us a lot more latitude. So it sends the students out to clinical with a much more realistic experience, so they're much more prepared to do many more procedures than we could have done over in the old building. So we're getting a lot of good response.
I'd like to welcome you to our nursing lab here in the Allied Health Center. We're real proud of our nursing program. It provides such a service to our community and surrounding communities. Our nursing program does a wonderful job with training students. They have great pass rates. Our nurses go out and excel in the field in our community and surrounding communities. I've been extremely proud of this program, and we're so glad that they are such a vital part of this new facility. And we have here some of our nursing faculty, and I'd like for them to tell us a little bit about the program and the facility and what this new facility means to them and their students. Kim, as the program head, I guess I could start with you.
Thank you. Very proud of our nursing program as well, and very fortunate to be in a new building that has allowed us to increase our capacity for students to do hands-on skills, provide technology to our students in a different atmosphere to learn. We're able to provide a lot of real-life scenarios or simulations for them to increase their critical thinking or clinical reasoning.
Well, I've been very proud to see some of our nurses out in the community. I know that some of our graduates are now in administrative positions at the hospital. I know that our nursing graduates have won first-year nurses of the year there at the hospital, and they are all over the surrounding area, the whole Piedmont Triad. And Dr. Sue, what have you noticed about the faculty and the students about their feeling about coming from the old facility to the new one?
I know on a personal basis, what I have found is that this gives us state-of-the-art equipment that allows us to put a realism into what our students can anticipate and expect, in part in their real-life journey as registered nurses. So this environment allows the faculty and the students to engage at a level that we really couldn't fully achieve in our previous environment.
Well, I'm sure that's correct, and you have so much more space and equipment, and you have the simulation opportunities that are just tremendous. And our nurses find jobs too, don't they? This is an area where there's a lot of need, and it's wonderful with our great pass rates we have that our students are getting jobs, and they find that the education here was worth it.
Yes, and I think too, knowing they have jobs, most of them before they graduate, has a lot to say about our program too.
It does. Nursing programs are very competitive around the state. It's one of the programs that has a state examination at the end that you have to pass for certification to be an associate degree nurse and to go out and get the job that you want. And our pass rate, all the pass rates are published all over the state, and if your program is not doing well, the state knows it. And our program is doing great, and the state knows it. So congratulations to you, and congratulations to your students, and I hope you continue to enjoy this facility. This is amazing. This is not like a college classroom. You walk in here and it's a real environment for a real hands-on experience. And so I know you and the students are enjoying it, and we're very proud to have you as a mainstay of this Allied Health Center. Thank you so much for all you do.
Thank you. Thank you.
Glad to be a part.